Welcome back to Little Steps, Big Gains and part 2 of our series, Let's Talk Speech for Parkinson's Disease. Now, as an occupational therapist, I do evaluations and I ask my patients, what is it that you want? And people tell me, I want to walk again, I want to get on a toilet. But there's another request that comes from my individuals with Parkinson's disease and their families. And they tell me, I want to be heard. And that is my motivation for creating this 2-part series. Now, I am an occupational therapist, so I pursued an expert in this field. Happens to be my little sister, but wait for her credentials, and that is Dr. Allison Hilger. If you haven't watched it, please watch part 1, because she does 2 important things for us. First, she breaks down some of these really big speech therapy medical terms. And that's important because medical terminology can feel like a foreign language. And a foreign language can do 2 things. First, it can be very intimidating. And second, it can be very exclusive. So it's important that we know those terms, especially if they've been given to us as labels. And the second thing she does is she gives us the 5 most common speech characteristics seen with individuals with Parkinson's. And that provides a good foundation for part 2 here. And here she's going to talk about treatment interventions. And in this video, she's going to start with interventions that do need to be done with a speech and language pathologist, but don't skip that because we can't pursue an intervention that we don't know exists, right? And then to hear it from a researcher that can provide the evidence behind it. The second thing she does is gives us strategies that we can implement at home. And you combine these, and these are so powerful because these help us achieve that goal of, I want to be heard. Now, as for Dr. Allison Hilger, she is a speech and language pathologist and researcher at the University of Colorado in Boulder. She received her clinical master's in speech and language pathology at Purdue University and then went on to pursue her PhD at Northwestern, where she pursued and investigated the impact neurological diseases have on speech. She's the director of the Speech and Motor Lab at the University of Colorado in Boulder, and she's doing a lot of research. She's looking at how individuals with ataxia perceive speech, speech therapy with individuals with ataxia, and then she's looking at the relationship between aerosol generation and speech production for disease transmission. I am so proud of her. She's doing a lot of cutting-edge research. Now, real quick, as for this channel, this is my channel and my dream to pursue and provide free therapy-led 30-day exercise programs, as well as free resources for education. I'm big on education, and you know that if you've been hanging out with me. So please check out my channel, subscribe, but better than that, share. Share with individuals that you think would benefit. So here we are. I'm actually going to resume my seat next to you. I'm going to return there, and now I'm going to turn the camera over to her.
Hello and welcome back. My name is Allison Hilger and I'm a speech language pathologist and a researcher at the University of Colorado Boulder. In my last video, I described the 5 most common speech characteristics in hypokinetic dysarthria, or the speech impairment that results from Parkinson's disease. In this video, I'm going to describe some evidence-based treatments for remediating or compensating for the impairment. But before I jump in, I want to say that I have no financial or non-financial interest in any of the treatments I'm going to describe. One treatment, LSBT, was founded by a researcher who worked in my department at the University of Colorado Boulder. However, I am not personally affiliated, nor do I receive any funding from LSBT. And those statements are important so that you know that I am non-biased when I am approaching these descriptions, and I am not receiving any sort of funding or compensation for describing these treatments to you. I'm going to break these treatments into 2 groups. The first group of treatments are ones that need to be implemented with a speech language pathologist or an SLP. So when I say SLP throughout the video, I'm referring to a speech language pathologist. That is because these treatments are too complex to do on your own, and they require special training or equipment to be implemented. The second group of treatments are ones that you can try to implement on your own, and I emphasize the word try because it's very difficult to modify your own speech. which is why receiving feedback from a professional can make the process more effective and less frustrating. So if you find yourself getting frustrated trying to modify your own speech, that's because it's very difficult to do on your own, and it's easier when you have a professional who's providing that feedback and providing the structure of the treatment. Also, if you remember from my last video, there is evidence that Parkinson's disease impairs your ability to correctly perceive your own speech. For example, you may think you are talking louder than you actually are. If you find that people tell you that you're talking too softly, but you think you're talking louder, that's because, again, Parkinson's impairs the way that you hear your own speech. And so that's another reason why it's so important to work with an SLP if you have Parkinson's disease. So as I said, this first group of treatments really need to be implemented with a speech language pathologist or an SLP. And the very first treatment I'm going to describe requires special training by the SLP. And this treatment is called the Lee-Silverman Voice Treatment, or LSBT. Specifically for the speech side, we call it LSBT Loud. Okay? You may see another term called LSBT Big. LSBT Big is more for movement and is used by occupational and physical therapists. LSBT Loud is the treatment for speech therapy. So what is LSBT? LSBT was originally developed by Dr. Lorraine Ramig in 2003 at the University of Colorado Boulder. It was specifically designed to improve speech in Parkinson's disease, although research has shown that it can help other neurological conditions as well. The concept of LSBT is quite simple. Speak loudly. Loud. That is the concept of LSBT. Loud speech. Okay? The concept of the treatment is that by speaking loudly, vocal quality becomes stronger, articulation becomes clearer, and rate of speech will slow down. So even though the concept of talking loudly seems simple, the treatment protocol is actually quite intense. Okay? LSBT requires you to attend speech therapy multiple times a week for multiple weeks. And to conduct LSBT, the speech therapist must be LSBT certified. They cannot use LSBT treatment unless they are LSBT certified. So if you want to receive LSBT treatment, you must find a speech language pathologist who is specifically trained in LSBT. So those are some things to keep in mind if you're considering seeking LSBT treatment. Just the amount of time is required of you, and also trying to find that SLP who is certified. I will say there are many SLPs who are certified in LSBT all over the country. So it should not be too difficult for you to find an LSBT certified speech therapist, but just keep in mind that they do have to be certified in order to conduct the treatment. Also, LSBT is an evidence-based treatment with 25 years of NIH-funded research. It has been shown to be an effective treatment specifically for speech and Parkinson's disease. Many people who do LSBT also find that they have maintained that improvement from treatment after the treatment was over. So it can be a very effective treatment for people with Parkinson's disease. So the first treatment I just talked about is a speech modification treatment. The next two treatments I'm going to talk about are actually devices that you're going to wear in either one or both ears. The first device is called SpeechVIVE. SpeechVIVE was developed by Dr. Jessica Huber at Purdue University in 2013. This device takes advantage of what we call the Lombard effect. The Lombard effect. The Lombard effect is what happens when you talk loudly when you are wearing headphones, for example. So when I'm watching a movie and wearing headphones and my husband asks me, "What do you want for dinner?" and I shout, "Spaghetti!" That is the Lombard effect. We talk loud when we have noise in our ears. So what this device does is it plays a babble sound in one ear only while you are talking. So the device can sense when you are talking, and it will begin to play a babble sound in your ear. That babble sound triggers that Lombard effect reflex that makes you automatically talk louder. So you don't even realize you are doing this. That babble effect just automatically triggers a reflex and you talk louder. Then the device is silent when you are not talking. So you don't have this babble playing in your ear all the time, only when you are talking. And then when you're not talking, it is silent. Now, many people say that when they use SpeechVIVE, they don't even notice the babble sound. So it's a bit of a personal use to see if you are comfortable with the device and if it helps your speech. The SpeechVIVE is an evidence-based device with numerous studies showing improvement in speech in Parkinson's disease. It is also covered by many insurances, so you can work with your physician and your speech language pathologist to try to see if you can get this device covered and whether it works for you specifically. So that device I just talked about is called the SpeechVIVE. The next device I'm going to talk about has a similar name, but it does something different. This device is called the SpeechEZPD. Now, the SpeechEZ was originally developed for stuttering, but researchers have found that it also improves speech in Parkinson's disease. So what does the SpeechEZ do? It is also a device that you wear in your ear, except it does something different. It works differently than the SpeechVIVE. The SpeechEZ alters how you hear your own voice by adding a slight delay to how you hear your voice. As we talk, we are hearing our speech. We hear our voice. The SpeechEZ takes your voice and it makes a slight delay in how you hear your voice. In the speech therapy world, we call this delayed auditory feedback. There is evidence that delayed auditory feedback can help reduce disfluency in Parkinson's disease. We talked about in the last video how disfluency can be common in Parkinson's, meaning a person may repeat certain words or syllables. So by delaying how you hear your own voice, using that delayed auditory feedback, it can reduce those disfluencies. There's also evidence that using delayed auditory feedback can improve how loud your voice is, and it can also reduce errors in your speech. Now, the SpeechEZPD may not be covered by many insurances, but there are funding options available on their website. And again, you should work with your physician and your SLP to try to figure out whether this device works for you and the funding options available to you. Okay, so those are the three main treatments that really require an SLP in order to implement, because they require either special training or special equipment. And again, those treatments are LSBT, SpeechVIVE, and SpeechEZPD. Now I'm going to describe some strategies that you can implement on your own or with an SLP. And again, these strategies will be much easier to implement with an SLP, but you can also try to start incorporating them on your own. The first few of these strategies focus on breathing. Breathing or respiration is the foundation of speech. So if we can improve how our breathing is coordinated and how strong our breathing is, we can have stronger, more intelligible speech as well. Okay, so the first strategy is notice how you are sitting right now. Are you hunched over? Are you leaning back like this? Or are you sitting up straight? Posture can vastly change how your speech sounds, and a simple posture change can really improve your respiratory control and your speech. So my tip is notice your posture throughout the day and notice how your speech sounds. Try sitting up straight with your feet on the ground and notice your breathing and your speech production. Sitting up with a straight posture is a very simple and effective tool for improving your speech in a lot of different settings. Think about the doctor's office, sitting in the car, sitting at a restaurant. Just by changing your posture, you can change how intelligible your speech is and how easy it is to understand, how loud it is, how clear your speech is. A simple posture change can vastly improve your speech. So that's my first breathing strategy. My second strategy is consciously taking a big breath before you talk. Now, in typical speech, when we talk, we take what's called a preparatory inhale or a breath before we talk. That's a little bit larger of a breath than normal. This big breath, this preparatory inhale, allows us to speak with a good vocal loudness and a good vocal quality for a few sentences at a time. If we didn't take that large breath, we would have to take a breath every few words when we talk, or we talk very quietly with maybe kind of a breathy vocal quality. So by taking a large breath before we talk, we have a strong voice, a good vocal loudness, and we can talk for a few sentences without needing to take another breath. So that's the second strategy. Remember to take a big breath before you talk. In Parkinson's disease, it's common that that breath before you talk is reduced. So it's a very shallow breath. And that's why often vocal loudness is reduced. People have a quieter voice, they have a breathy voice, and that's why they often have to take these breaths multiple times while talking. So that second strategy is take a large breath before you start talking. And it will require a little bit of conscious effort to think about, take a big breath and start talking. So those are the first two breathing strategies, sitting up straight and taking a big breath before talking. The next breathing strategies I'm going to talk about are a little bit more complicated and maybe more effective to implement with an SLP. The first focuses on strengthening your respiratory system. So to strengthen your respiratory system, there are devices you can use that you breathe into with resistance, and that results in a stronger respiratory system. So the two main devices that are used are called the breather and the EMST, or the expiratory muscle strength trainer. Those are the two main devices used, the breather and the EMST. And again, I strongly recommend working with an SLP, but you can also purchase these on your own. The way they work is you take an inhale, and then when you breathe out, you breathe through the device, and the device has resistance. So you have to really breathe hard in order to breathe through the device. You can change the resistance to make it easier or harder. So as you make progress, you can increase the resistance just like you would do on a weight machine. But this time, it's a breathing device. Okay, so what that will do is it strengthens your respiratory system. So that way you have a stronger breath support, which results in a stronger voice. So the second strategy focuses on retraining where and how often you breathe. This strategy takes a lot of practice and effort and can be difficult to implement on your own. In typical speech, we breathe at these locations called clausal boundaries. What is a clausal boundary? A clausal boundary is typically where we would write either a comma or a period if you're going to write out what you're saying. It's a place that's just a natural place to pause, right? Because it would be unusual to pause in the middle of a sentence or the middle of a phrase or the middle of a word. So we breathe when it's a natural place to pause. In Parkinson's disease, we find that this pattern has been disrupted, and people often pause and breathe in the middle of a sentence, the middle of a phrase, or the middle of a word. So what this treatment focuses on is retraining that pattern. So we focus explicitly on pausing and breathing at locations where there's a natural pause or a clausal boundary. So you can try to practice this at home. Maybe try to find a newspaper or a magazine. Find a paragraph and read through it in your head. Find locations that seem like natural places to pause, and you can go ahead and mark them with a permanent marker or a pen. You can kind of see I've done that in orange. So once you have marked them, and again, these are places that are typically locations where there's a period, a comma, maybe a dash, or as you're reading it and you find yourself naturally pausing at certain locations, that might be a good place. So once you have these places marked, then you can read the paragraph out loud and try not to take a breath or a pause until you get to those locations that you have marked. If you find that you're running out of air before you get there, that means that that phrase that you marked is too long and you need to break it up. If that's the case, try to find another location in that phrase or sentence where you feel like it's a normal location to pause, and then try again. And so this is something that you can practice every day. Maybe pull out the day's newspaper, the day's magazine, mark those locations and practice reading it out loud. As this becomes more normal, as you become better at it, you could try to implement this in regular speech. But again, that can be difficult to do on your own. Okay, the last strategy I'm going to talk about relates to the rate of speech, or how fast or slow you are talking. As I talked about in the last video, speech can become quite rapid and accelerated in Parkinson's disease. A good strategy to use to try to slow down that rate of speech is to use a pacing board or a pacing technique. For example, if you're using a pacing board, you can tap on the icons on the board either for every word or every syllable. I am going to the store, or I am going to the store. Again, practice, see what works for you. There are a lot of different pacing boards you can find online for free. Just Google pacing boards. You can make your own using a PowerPoint or Microsoft Word. All you need are some icons in a row, circles, hearts, leaves, anything that you like. Just a list of icons in a row that you can tap as you talk. An alternative pacing strategy that you can use on the go is to use your hand, and you can tap your thumb with each finger as you're talking. Again, either for every word or every syllable. My name is Allison, or my name is Allison. So you can implement this on your own. What's great is you can have your hand at your side and be tapping on your side as you're talking, and you don't have to carry that pacing board around. Many people find it's beneficial to have both a pacing board and to also use the finger technique and to switch off between them. Okay, so that is a very effective approach to slowing down your rate of speech, which can also result in more clear speech as well. So, great strategy you can implement on your own. The last thing I want to talk about is deep brain stimulation. Deep brain stimulation can be very effective in Parkinson's disease for other motor functions, such as tremor or gait or walking. However, it has been shown to have either little or no effect on speech. And I do want to share this because, again, deep brain stimulation can be very effective for some people. And I want you to know that if you use this, you will probably still need to have speech therapy because it usually has little or no effect on speech production. So those are the treatments for speech in Parkinson's disease. I talked about treatments that need to be implemented with a speech therapist, and also some treatments that you can try to implement on your own. So I thank you so much for listening today. If you have any thoughts or questions, you can comment below. You can check out my lab website in the notes, and you're always welcome to email me with your thoughts or questions. Thank you so much. Have a